Pharmacy resident Megan Gross is joining us this morning to talk more about the ways pharmacists are involved in our overall wellness and well-being too. Megan, good morning to you.
Morning.
Okay, so first off, why don't we talk about what a pharmacist actually does, right? Talk about some of their key duties and their roles.
Absolutely. So I feel like pharmacists in general are kind of often viewed in that more traditional medication dispensing role, a lot of times what you associate with the pharmacies in your community. But pharmacists are located in many different settings, including in hospitals where they work with other healthcare providers to provide um, appropriate care, make sure medications are appropriate and efficacious. They work in clinics as part of a care team where they provide chronic disease management. They work in research labs for research and development of new products. And even the pharmacists that we see in our community settings, they usually offer services in addition to medication dispensing, such as the immunizations, which were big during the pandemic, comprehensive medication reviews, which is kind of looking through medication lists to make sure all the medications are appropriate and safe, and even services like smoking cessation to try to help improve the health of the overall communities.
And kind of interesting here too, it was news to me as this morning, there are different types of pharmacists out there. Why don't you talk to us about what a primary care pharmacist is and how maybe they help patients manage chronic conditions?
Absolutely. So, a primary care pharmacist or an ambulatory care pharmacist, they work as part of a patient's care team through collaborative practice agreements or agreements with providers to manage chronic disease states. So, they manage a number of conditions, including diabetes, anticoagulation or blood thinners, heart failure, COPD, asthma, a lot of chronic conditions that patients face. And usually, how they work is we have our meetings one on one with patients. We prescribe medications, titrate up medications to try to optimize patients' therapies to improve their outcomes overall. We also provide a lot of education to patients regarding their chronic disease states and kind of why they're taking the medications that they are.
Okay, really good insight, Megan Gross from SSM Health. Thanks so much for being with us. We appreciate it.
Thank you very much.